Today I want to talk to you about health reimbursement arrangements, or HRAs. They've been around for quite a long time. Essentially what an HRA is a supplement to a group health insurance plan. When an employer will have uh, a plan, usually a fairly rich plan, and they want to offset increases in premiums by lowering the benefits, essentially increasing the out-of-pocket costs to their members, saving premiums, and then reimbursing employees for out-of-pocket expenses, but only if they're incurred. So it's a pretty sound strategy, especially when you consider that about 5 to 10% of the members on any group health insurance plan will typically account for about 80% of the claims. That means those other 90% of the members have very little claims, but you may be overpaying for an insurance for them. So it's a good strategy. So I just want to review that with you today. So I've used this as an example, a 50-person group with 30 single employees, 5 couples, 5 parent children, and 10 families. Current plan, kind of borderline in the gold metallic level if you're a small employer. $2,000 deductible, 2 times per family, so $2,000, $4,000 deductible, 30% coinsurance, $8,000 out of pocket for an individual, $16,000 for a family, with a 30/60 copay, $10, $50, $90 3-tier prescription drug card with a $200 prescription deductible. Now this is not an HSA style plan, so in this case, the $2,000 deductible and coinsurance apply to only certain services. There's a first dollar benefit or copayment for prescriptions, office visits, and for maybe urgent care, things like that. The deductible is going to apply towards inpatient hospital, outpatient hospital, radiology, sometimes emergency room. So these are real numbers. This is a real New York small group account. So in New York, small groups all the way up to 100 lives, and it's community rated. So the rates are fixed rate. So in this scenario, they're paying a current premium of $80,000 per month, $965,000, almost $966,000 per year. That's the current premium for this plan. This employer got a renewal. Not horrible, 6.55%, but when you're talking about big numbers, that 6.55% increase was brought them to just under $86,000 per month and $1,029,000. So imagine that, 50 employee company, 30 singles. They're paying over $1 million in premium in total. Of course, the employees are going to share in some of that typically. So what we did in this scenario is we took that plan and we said, let's look at an HSA plan as an alternative. Now, the good thing about New York small group market is that if you implement some sort of reimbursement or funding by an employer, it does not impact the premiums. These are community rated plans. So we know that this plan, which is now an HSA, which has a $3,000 deductible, $6,000 per family, 20% coinsurance with a $7,150 individual out-of-pocket and $14,300 family out-of-pocket, also has a 30/60 copay and a 10/50/90 prescription card. The difference here is that this is an HSA compatible plan, so all benefits or all services are subject to the deductible first, with the exception of preventative care. So routine adult and well child care still has to be covered at 100%. The prescription drug card here has an embedded deductible. It's the medical deductible, so no separate $200 deductible. This plan, at the current premiums, and this is based on the second quarter of 2023 here in New York, drops the monthly premium to $74,841. So compared with the renewal, we're talking about a $10,934 difference per month in premium. That's $131,208 difference compared to the renewal. Okay, so it's actually 7.75% less expensive than current. Okay, so now we have the medical plan, we have this pool of money. How do you structure the HRA? So in this case, we know that we're saving $131,000 in premium. That's a shared savings between the employer and employees, depending on how that works. Every company is a little bit different. So now we can say we're agreeing to reimburse $2,000 per single or $4,000 per family. Any employee with a dependent, could be one or more dependents, would get $4,000. And if we did that for 30 singles, 5, 5, and 10, that's an exposure of $140,000. Okay? So we know that's an exposure. It's a pretty big number. It's a little bit more than the savings, but we know that we're not going to be paying all of that. It's an intimidating number, though, potentially. We also look at potentially, what if we wanted to enhance the benefits and make this change and agree to reimburse employees all the way up to the full deductible and coinsurance? We can do that. The numbers change a little bit. Now it's a $210,000 potential HRA exposure. The thing about HRAs that are a little bit iffy or questionable is, how much are you actually going to pay? Because most employers don't have real actionable data or claims data, especially in the small group market, we have to make some estimates. So if we estimate that the employer is going to end up paying 20% back of the $140,000, that would be $28,000. It'd be over $100,000 ahead of the game. We can estimate 30, 40, 50%. 50% is pretty much on the high side. We don't see many clients going anywhere near that, but it's possible. So we'd like to, be completely forthcoming. So potentially $70,000 in reimbursement at this level, or $105,000 if we wanted to cover the entire deductible and coinsurance. Okay, $105,000. We're about $26,000 ahead. Of course, there's going to be some administration fees for the TPA that you're typically going to use a TPA to adjudicate those claims, confirm that the service that members are submitting are actually medical claims. There's usually a debit card for employees to use. So it's a proven strategy. That's the scenario. But there's some cons. There's some things that might be arguments against an HRA. One is the employee's excess out-of-pocket exposures, right? Prescriptions now are going to be part of this. You're going to be paying top dollar. The insurance carriers discount rates for prescriptions, but you're not paying just the copays. You're paying the full cost of those medications, which, again, because of a lack of actionable data, most employers aren't going to have. There's a lack of predictability. We talked about that. We don't know what the actual reimbursement is going to be. And we've done nothing to address steerage of the healthcare system. We know that the healthcare systems, the hospitals, all the facilities, the providers, they're structured in a way to drive services towards where the healthcare system makes the most money, not necessarily what is in the best interest of the patient from a cost standpoint or a quality standpoint. So an HRA in itself does not address that. Price transparency is still a problem. You're not getting any guidance from those facilities on what the cost is, although there are laws in place for certain services that have to be disclosed up front. Unfortunately, most consumers aren't aware of that and aren't asking the right questions before they get services done. It doesn't do anything to address doctor quality. We don't know that they're going to the best doctors. And isn't that really what the primary goal of an employer should be when they're making this huge investment? This 50-person company is investing $1 million towards health insurance, but they're really buying access to health care. We believe that getting people to the best doctors is really what the underlying goal should be. And HRA exposure is intimidating. We talked about that, right? If you want to be, on the high side, on the 50% of the exposure, is there really a lot of benefit sometimes? And that has to be weighed out by the employer. The pros of an HRA, statistically, 5 to 10% of the members account for 80% of the claims. So why are we paying top dollar for this rich plan? We're over-insuring so many of the employees. So it makes a lot of sense to appropriately insure the group and then use this premium savings to fund the exposure of the higher cost claimants. Properly insured for 90 to 95